Hello, guys. Artificial intelligence is being used almost in any domain now, and more use cases are appearing almost every day. I have been asked by various people in private comments and DMs that if there is any other or private model which they can use privately locally to inquire about sexual health that include both male and female. So instead of replying individually privately, I thought, okay, I'll come out, I'll just create this video because I have found one of the best medical LLM, which is not only to the point but also it is quite, I would say, responsible, and the responses are of very good high quality. And that model is BioMistral. In previous video just today, I showed you how you can locally install it, and if you haven't seen this video, I'll drop the link in video's description, and you can read further about it as how you can do it, or you can just click on the link which will be appearing on your screen, and then you can see how you can install that locally and privately. Now, having said that, in this video I'm just going to show you how you can use different prompts to ask about sexual health for both male and female from BioMistral. But before I do that, I really want to make sure that you understand these are just for educational and research purposes. A large language model as of now cannot be a replacement of your doctor or physician. So if you're having some issues, I would, or if you want to know more, maybe not maybe but definitely see a doctor, consult with a physician. Don't try out anything at home. Don't just believe whatever models are saying. And also make sure that you understand these models hallucinate, and sometimes they just simply give you in accurate facts. So the purpose of this video is just to show you the performance and responses from the model, so that you could see that how far AI has come. There might be some general advice which would be harmless, which I would leave it to your discretion to follow or not. But remember that sexual health encompasses mental and emotional well-being, so it would be great that you would acknowledge this and just take it on surface that this is just a large language model demonstration, and I'm not a physician, I'm not a health professional. So please don't use any of the responses in this video as some sort of advice or as some sort of suggestion or recommendation. Okay, having said that, let's dive deep into it. This BioMistral is quite a fine model. It is a suite of Mistral based further pre-trained open source models suited for the medical domains and pre-trained using textual data from PubMed Central Open Access, and all the models are trained using CNRS, which stands for French National Center for Scientific Research. There is a lot to it, and this BioMistral is an open source LLM tailored for the biomedical domain, utilizing Mistral as its foundation or base model and further pre-trained on the dataset which I have just mentioned. And the researchers behind these models, which are mentioned in this paper, and I'll drop the link to this Hugging Face card in video's description, have done a fabulous job for exploring, for evaluating this BioMistral, and it has passed almost all of these on with flying colors. Also, it is not just in English, it is multilingual, so you can use 7 languages for this model, which is amazing and awesome. Okay, and you can go through this paper or this Hugging Face card to see what those languages are. Now, having said that, let's play around with this model and see how we can use this for our sexual health advice, prompts. Now, the tool which I'm going to use for this purpose is called as LM Studio. If you're not aware of what LM Studio is, I have done various videos on it, so please go through the channel and see those videos in order to see how to install it. Now, in order to use it, all you need to do is to launch it, click on home page, type BioMistral, press enter, and then download any of the quantization one. Then click on these 3 dots from the middle, select the model, like selecting it, and then in the right hand section you can see that I'm offloading it to GPU with minus, I haven't, so let me quickly do it. So -1, that's it, and let me load the model again. There you go. So then what would happen is that it will try to offload as many layers of this neural network to the GPU. So let's wait for it to load, and then we will start playing with it. Okay, let me actually make it bit smaller so that it will fit on the screen. Okay, that is cool. Then let me go here. That is good. Okay, now let me ask it the prompt. In this one, I'm asking it, I have been experiencing pain during ejaculation. What might be causing this and what should I do? Let's see. Wow. So you can see that, look at the quality of this model. And remember, this is not a full model. This is just a base model. Now, it is just telling us all the medical terms, and I don't really know what exactly how to pronounce these, but you can see that the responses are of very high quality. It is telling you what exactly this is called, and these are the causes, and then also some information around treatment. But it is good that it is recommended to consult a medical professional for proper diagnosis and treatment. Cool. Let me ask it another one. How can I increase libido in a natural way? Let's see. So you can increase it in, so it is telling you, it is saying that enough sleep, exercise regularly, and then include food such as lean meat, nut, seed, vegetable. They all are great choices. And then maybe some supplement which I don't know about. So, and then few others. Avoid smoking and reduce the use of alcohol. Communication is key, by the way. Cool. Okay, let's see if there is any other one. Okay, now I'm going to ask it a bit more angular questions here. And in this one, I'm asking it, I'm interested in getting tested for STI, um, but I think this STI stands for sexually transmitted infections, but I'm nervous about the process. Can you explain the type of tests, where to get tested, and what I can expect? Awesome. So you see that if you are reluctant to ask it from anyone, you can ask it from LLM. So you can see that how quickly and how cool responses are. Amazing stuff. Now you can see the response is quite good, that it is telling you the common ones, HIV and all the stuff, and then it is telling you how you can, what are the best way of doing it. Amazing stuff. Okay, now let's check another one. Again, this is a male one. I'm just saying I've noticed changes in my testicles. Should I be concerned? What kind of doctor should I see? And it is telling you it is normal throughout a man's life, but it also can be a sign of health issue. And then it is telling you some potential reasons. And then it is telling you to see a doctor. And then also if you notice a lump on your testicle, pain, swelling, a change in temperature, and then amazing stuff. Very, very cool. Okay, so these are few of the male ones. Let's see some of the females one. I'm asking it, my periods have been very irregular lately. What could be the cause? Should I see a doctor? There you go. So it is telling you what are the varieties of what could be the factors, and then just discussing it further, and then it is telling you about any underlying health conditions and so on and so forth. Amazing stuff. Okay, now let's see one more question around the female one. I'm interested in different birth control options. What are the pros and cons of various methods? There you go. So it is telling you what are the different methods, because I have just curtailed the output just to show you in the screen. So it is just showing you this, but just to get you an idea that you can uh, almost get it. Let me ask it one more question. This is again related to female health. I think I might have a yeast infection. What are the symptoms? Are there any over-the-counter treatments? Okay, so it is telling you what could be the cause and the symptoms, and then for the recommendations, it is telling you that go to the physician, which is correct answer. Cool. Let me ask it another one. Now it is more towards the sexual health. So it is telling, I've been feeling interested in sex lately. How do I know if this is just a temporary change or something more serious? And it is telling you all the stuff which could happen, which could reduce that interest, like stress, medication, relationship issues, and all that stuff. Amazing stuff. Okay, so you can see that the quality of the responses is amazing. Now, I know for a fact that there are more and more people, various of my friends who are very introverts, who are reluctant to even discuss these things with their partners or with their doctors. So, but if they can install these large language models privately, locally on their systems in full confidence that none of their data or questions are being seen by anyone else, then and even they can share their medical information as a context to it, then sky is the limit, and they could get a very very well directed advice from the LLM. But of course, even then, I would highly suggest that before you take any practical steps, go see a doctor. That's it, guys. Again, just for educational purposes. And if you like the it, please share your thoughts in the comments. And if you like the content, please consider subscribing to the channel. And if you're already subscribed, please do me a personal favor and share the video and the channel on your social media accounts. That helps a lot. Thanks for watching.